Countries around the world, including the US, are falling short of their vaccination targets due to low uptake of vaccines. In July, US President Joe Biden said Facebook and other social media platforms are killing people by enabling the spread of misinformation about vaccine dangers that has dashed his administration's hopes of vaccinating more than 70% of the US population. The culprits, the disinformation dozen, 12 people that the White House said were responsible for most of the coronavirus misinformation. They were initially identified back in March by the nonprofit Center for Countering Digital Hate, who called on Facebook to shut down their social media pages. Facebook has refuted accusations of sparking fear through its platforms, but recently imposed penalties and removed dozens of pages, groups, and accounts linked to several people who violated their policies. Now, misinformation about vaccines has given rise to a new terminology when it comes to battling the COVID-19 pandemic: Infodemic. Hello, I'm Demiake Mwakaliele, and this is Our Voices. On today's program, we will look at the COVID-19 infodemic and how misinformation, myths, and rumors about the vaccine has spread as quickly as the disease itself. And we'll break down the facts versus fiction surrounding the pandemic. Health experts pegged their hopes on the vaccines to beat the COVID-19 pandemic, but fear, fueled by misinformation, has kept many from getting vaccinated despite reports of the virus's increasing potency and virility. Elisa Muntali, a global public policy health consultant based in the U.S. state of Maryland, says misinformation can only be countered with more credible and reliable information.
I do think that most people in the world now, we've made a lot of advances in technology. So you have people in rural areas and villages in Africa that have WhatsApp. We're getting a lot of information through social media. But the problem is the absence of the true information, the real information. In order for us to counter some of the misinformation, mistruth, and myths about this virus, we need to get trusted leaders, those that people in communities listen to.
Now, some would say that then it's really a question of how do you get the public to trust. I mean, here in the United States, President Biden was among the first to get vaccinated. In a lot of African countries, you're seeing leaders literally as the first candidates for vaccines. So what more really can be done? And of course, the WHO, most of these really big, Africa's CDC included, they really are pushing this message about how safe these vaccines are, but they still seem to be overpowered by what's coming out in the social media. So how do you think this fight can be won?
Yeah, I think it's a multi-sectorial approach. So it cannot be just the government leaders. You have to go down to where people are. Most of our people in Africa are in the rural areas. So what, I'm doing in Malawi is working with community-based organizations, and there's a lot of progress that they have done. So what they've been doing is training community-based leaders, from village man to the chief, to the community health workers, because those are the guys that these populations have day-to-day contact with. And so they are hearing it. And while it's great that they're seeing their national leaders, sometimes our messages at the national level haven't been very consistent. I mean, I think here in the United States, we'll say the same. We've been arguing about mask mandates. It's become so politicized here. And so what do you believe? You have people at the county level that are like, well, I'm going to mask up, make sure our population is masked up. Then you have people at, the schools that are fighting. And so it is very confusing. What do people do? And so when that happens, where you want to have the ambassadors to push this message forward are the people that have the trust and the constant contact with communities.
You mentioned how, part of the explanation about why there's so much suspicion around vaccines, specifically when it comes to COVID, is because it's such a new disease. And people feel that, there wasn't enough science behind, the vaccines that now people have to literally trust to be safe after they've taken them. Now, just recently, the FDA approved the Pfizer, and many people are thinking that that maybe was one big move to at least get more people vaccinated. What do you think?
Yeah, I mean, it is, I understand why people are hesitant. We do know that many of these agencies and these leaders stood up. They stood up for the science. And while things were done in an expedited way, none of the process of, kind of approving these drugs was compromised. And so I think people should understand that. But given where we were, I think we will look back at the advances of the COVID vaccine and just marvel.
What are your thoughts about the reasons people are rejecting vaccines from China specifically?
I think Africa has had a long, relatively recent long history with China. I think, there are some misperceptions about the quality of goods and services that might come out of China that particularly are exported to Africa. But I also think that, just the origins, we believe the origins of this virus are from China as well. And I think that's playing into it. And also, with China and some other countries, I also say with Russia, there hasn't been the degree of transparency in how these vaccines have been put together.
So it's gotten to the point now, Elisa, where a lot of administrations around the world, including here in the United States, are now mandating vaccines because the uptake has not been what it was expected to be. Is this going to create more pushback, you think, more resistance? Because now it's almost a federal requirement in some areas to be vaccinated.
I think we have a lot more work to do on the trust level. And so, before you get to a mandate, I think we can do better with working more closely with people. I think there will be a lot of pushback if we were to mandate now, because after all, we have healthcare workers all across this world, and especially in Africa, where they're hesitant because not just because of the myths about, perhaps you're being injected, with a microchip so that people can track you and follow you, but because of side effects. And those are real concerns. When people say, oh, it's 1 out of a million. What if that's you? If people don't believe in this will feel forced. And I think we have a long way to go.
In a sign that Tanzania has now acknowledged that COVID-19 exists, President Samia Suluhu Hassan has not only pushed messages of social distancing and mask wearing, but she was among the first to get vaccinated. But as the third wave of coronavirus sweeps across Africa, many citizens still seem reluctant to adopt safety measures. Charles Kombe reports from Dar es Salaam.
Ramadan Juma is calling passengers into a bus, popularly known by locals as Dala Dala, riding in the busy city of Dar es Salaam. Neither the driver nor his passengers are wearing masks to prevent the spread of COVID-19. Juma says lack of clear instructions from Tanzanian authorities have led many to become less serious about the pandemic.
There's no emphasis. I cannot wear a mask because when I look at the people in the surrounding, there's no one who is wearing masks, no sanitizers, and also there are no water tanks here. In short, there's no shock from my fellows, so I cannot be shocked as my fellows. I take it the same.
A week ago, for just the second time in a year, Tanzanian authorities gave statistics for the number of COVID-19 patients in the country. They said from January through July 8th of this year, there were just over 400 COVID cases. Rights groups say numbers over the last year are likely much higher. The government says it is currently working on importing vaccines and calling for people to take preventive steps.
The government continues to ask every citizen to take precautions against COVID-19 by following the guidelines from our health experts, since prevention is better than cure.
It's a sharp turn from the position of the late President John Magufuli, who denied the presence of the virus in Tanzania and discouraged the use of face masks. Rights activists accuse the government of failing to provide good information and leadership in the face of the pandemic.
The government has created a big division in the society due to the fact that society has people with different understandings.
Tanzania's health minister says the country must unite against the virus.
This outbreak of disease is like a war because it claims the lives of many and weakens the economy of the country. We must join forces, and I'm expecting to see you, with your cameras, go into public buses telling people about this information, and then you say you have participated in the war.
Meanwhile, Ramadan Juma continues with his work, despite being at high risk of contracting COVID-19. Juma says serious emphasis on prevention will make people, especially his passengers, to take precautions, something that will also make him do the same. Charles Kombe for WEWE News in Dar es Salaam, Tanzania.
Now, how susceptible are you to misinformation spread through social media, and how do you verify or disprove myths or untruths? Tell us on our social media platforms. We are on Facebook, Instagram, and Twitter. Our handle is @VOA Our Voices. We are also on WhatsApp, and our number is on your screen. Now, more about breaking the myths surrounding COVID-19 by bringing just the facts. That's coming up next after the break on Our Voices.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the government to listen. It really was powerful because it showed what is possible when men and women band together and say enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back. You're with Our Voices. Now, vaccine hesitancy has been mostly linked to misinformation and fake news. But could other factors, such as lack of enough information about the virus, also be a factor? Now, despite COVID-19 vaccines being available to all South African adults, uptake remains low, with fewer than 20% receiving their first dose. The Muslim Association of South Africa is one of many groups combating vaccine hesitancy by delivering jabs to doorsteps. Linda Givtash reports from Johannesburg.
Dawn Krotz received her Johnson & Johnson COVID-19 vaccine in the comfort of her South Johannesburg home. While the vaccine has been made available to the 64-year-old since April, Krotz says rumors about the side effects made her hesitate. But the reality of the deadly virus changed her mind.
I decided to get it because I saw my daughter-in-law's father got so sick and he passed away. And then I thought, hey, let me also get it. I take the flu vaccine every year. I go and they buy it and they give it to me. And then I thought, no, let me do this also.
With South Africa's COVID death toll surpassing 79,000, volunteers like this paramedic are scrambling to quell people's vaccine fears. The country's Muslim Association launched an at-home vaccination program to provide individual attention to allay concerns and to remove the barriers of traveling to a clinic.
And I think it's just a misconception, people reading on social media, people hearing from different people that is bad for you, that is man-made, how can we create a vaccine in a year, etc., etc. So there is a lot of hesitancy that we've come across, but we put their fears to bed.
South Africa's vaccine rollout has faced hurdles providing the vaccine, but experts say the more recent lag in inoculating the country's 59 million people is the result of misinformation fueled by social media, along with more practical concerns.
One is very worried about the social media rumors. Broadly, the concerns about vaccines seem to be a bit more reasonable. And in our survey, for instance, it was shown that mostly individuals were worried about safety, and they were mostly worried about the turnaround time for developing the vaccine.
Another problem is access to transportation and basic information, especially among the elderly.
The registration for vaccines are electronic, and even though you can at sites also register, you need to know where the sites are before you can show up there.
For people like 22-year-old Kurt Fisher, who is quadriplegic, getting to a vaccination site is difficult both physically and mentally, says his father. The rest of the Fisher family has been vaccinated.
I would have sacrificed not having it to give him my shot if possible, that he's first. The familiarity of being able to be in his house is a big benefit, that there's no stress involved going to a foreign venue.
Experts say volunteer efforts are closing the gap in vaccinating more people, especially the most vulnerable. President Cyril Ramaphosa applauded the country's youth on Monday for rushing to sites, as vaccines were made available to those as young as 18. But experts warn that fears and other barriers still need to be addressed, or the latest uptick could fizzle out as it did among older age groups. Linda Giftash for VOA News, Johannesburg.
To combat hesitancy, the Poynter Institute, World Health Organization, AFP, and other organizations, including the Voice of America's Polygraph Info team, has set up web pages to debunk some fake news surrounding COVID vaccines and the pandemic from reliable sources. Let's take a look at some of the claims. Claim: vaccination against COVID-19 causes widespread infertility problems for men. Verdict: false. Factcheck.org reports that a new study found that there was zero or negative effect on sperm levels in men after they received the COVID-19 vaccine. Another was a YouTube post shared on Facebook that claimed that COVID-19 vaccines' spike protein is toxic. Verdict: false. The Poynter Institute's PolitiFact reports that experts say that there is no evidence that the spike in proteins produced by the Moderna and Pfizer vaccines or the spike protein created by genetic material in the Johnson & Johnson vaccines are toxic. Facebook, in fact, flagged the post as part of its efforts to combat false news and misinformation on its newsfeed. And to debunk one of the most common myths around the pandemic is the question about the effectiveness of hydroxychloroquine or chloroquine, a common treatment for malaria and certain autoimmune diseases to treat COVID-19. Verdict: false. The World Health Organization Mythbuster says clinical trials confirm that hydroxychloroquine does not prevent illness or death from COVID-19. Evidence from these studies show that hydroxychloroquine has little or no impact on illness, hospitalizations, or deaths. So what will it take to demystify the myths or untruths around COVID-19, and what will help to drop the suspicions that people have about the disease? Public health expert Elisa Muntali again says information, information, information.
There are a number of new fact-finding or fact-busting organizations that have developed as a result of COVID-19. And I think there's one in Ghana, I think it was the first one that was ever developed, but all of these collectively have been able to dispel about 1,300 myths that have been circulating across the continent. The World Health Organization also has dedicated space, quite a bit of information, because they do believe, as you mentioned earlier, that, bad information can kill you. It really can. And what happens is, in the absence of people getting the right information or being able to shift through that information or to hear reinforcement of the right information, they're going to follow this, especially if their friend forwarded it to them. I just recently got one of those, myths, and it was scary because it said WHO. And I was like, wait a minute, oh my goodness, but you can report those. And so I reported it to the WHO platform where you can report all of these myths. So I think individually as people, if we have the right information, we should try to dispel it to the extent that we can, and try to get it to the folks at the national, international, global levels that are working to dispel these. But I understand why they exist, but it's a huge problem for us.
It's time for another break. When we come back, we'll look back at the history of vaccines and how they have saved lives for over 2 decades and see new vaccines on the horizon. Stay with us. Welcome back. You are with Our Voices. Now, vaccination programs against some of the world's deadliest diseases have saved millions of lives over the past 20 years, according to researchers. But continuing progress is threatened by the COVID-19 pandemic, as Henry Ridgewell reports from London.
An emergency vaccination drive in the Democratic Republic of Congo after a measles outbreak in 2020. Efforts like this have saved millions of lives, says a study. Researchers looked at vaccination programs over the past 2 decades, targeting 10 infectious diseases across 112 low and middle income countries. They found that some 50 million lives, mostly those of children, had been saved by vaccines. They included diseases such as measles, hepatitis B, human papillomavirus or HPV, and yellow fever. The research was led by the Vaccine Impact Modelling Consortium, funded by Gavi, the Vaccine Alliance, and the Bill and Melinda Gates Foundation.
If we continued with the vaccinations in our projections, so beyond 2019, we'd avert another 47 million deaths. So huge numbers. And really what we wanted to kind of show in this paper is this is what we projected vaccination to look like before the COVID pandemic, and wanted to emphasize, these long-term effects, these long-term benefits of vaccination going into the future.
Immunization programs have added benefits beyond the prevention of specific diseases.
For example, if people aren't getting sick of vaccine-preventable diseases, then that means there's less stress on healthcare due to those infections, which means you could potentially be treating people for other things.
But the researchers warn that the COVID-19 pandemic has disrupted vaccination programs and could lead to a decline in coverage.
We've got not only healthcare services stretched by possibly treating people infected with COVID, we've also got people's personal choice. They might put off going to seek an immunisation just because of fears surrounding being infected with COVID.
The World Health Organization in April launched its Immunization Agenda 2030 to try to get vaccine programs back on track and reach even more people.
It would mean reducing by half the children who are completely left out of essential vaccines, the zero-dose children. It would mean achieving another 500 introductions of new and underused vaccines in low and middle income countries.
Scientists say the huge number of lives saved demonstrates the stunning advances of modern medicine and the importance of keeping other vaccine programs on track despite the COVID pandemic. Henry Ridgewell for VOA News, London.
In an exclusive interview with VOA, the director of Oxford University's Jenner Institute says their new malaria vaccine, tested in Burkina Faso, has shown a preliminary efficacy rate of 77%, which could help prevent over 400,000 deaths a year, most of them in sub-Saharan Africa. Here's a report by Henry Wilkins from Kaya, Burkina Faso.
Pella Sawadogo fled Tulgadji village 2 years ago when insurgents attacked, killing her neighbours and brother-in-law. She thought she'd escaped certain death, but last week one of her daughters, Marie, was diagnosed with malaria.
She got some more medicine and we were told to go back home. That was the last prescription she got before passing away at home on Sunday. It affected me a lot. I can't sleep at night. I can't eat.
More than 400,000 people die every year from the mosquito-borne disease. most within sub-Saharan Africa and mostly children under 5 years old. But there is hope. In an exclusive interview with VOA, the director of Oxford University's Jenner Institute says their new malaria vaccine tested in Burkina Faso is showing game-changing results.
So what's so exciting about this result is that 140 malaria vaccine candidates have been tried in clinical trials over the years, and none of them has come up with an efficacy over 75%. That's what the WHO, the World Health Organization, is looking for to be really useful in controlling malaria in Africa. In our first attempt with this vaccine, we see 77%, and we think we can improve on that further. So it's real progress. It's unprecedented.
The Jenner Institute says the cost of the new vaccine is expected to be very low and believes widespread use would prevent hundreds of thousands of deaths in Africa each year. While testing is not yet complete, the initial results are also raising hopes with medical aid groups like Doctors Without Borders, MSF.
If the modalities, the characteristics, would make it well feasible to roll out in Africa, that could indeed be a game changer.
The malaria vaccine is entering the third phase of trials in Burkina Faso, Kenya, Mali and Tanzania, and could be widely available in as little as 2 years. But the Jenner Institute, which developed the AstraZeneca coronavirus vaccine, is talking to regulators to see if this vaccine can also be fast-tracked for quicker use.
We're making the point that more people died of malaria in Africa last year by a factor of maybe 4 than died of COVID. So why isn't malaria a priority?
The malaria vaccine will come too late to save the millions who have died over the years, including Sawadogo's daughter Marie. But perhaps by the time Pauline is old enough to understand what happened to her twin sister, malaria deaths could be a rarity in Africa, instead of a day-to-day reality. Henry Wilkins for VOA News, Kaya, Burkina Faso.
And that's where we end our show this week. To catch up on the latest episodes of Our Voices, go to the VOA website at voanews.com or YouTube. Thanks to my Our Voices colleagues, and on behalf of everyone here at the Voice of America, I'm Dimiake Mokadielye saying thank you for watching. Stay safe.
Mtu mahiri anayesema maajabu ambayo hayawezi kulinganishwa katika nyakati hizi maalum. Katika nguvu za Mungu anayetunza siri za ardhi kutoka inchi hata inchi. Tanzania, sasa ni muda wenu kutazama mubashara.
To show you that Jesus is Lord over Hollywood. Best production design, the movie The Shape of Water.
The Shape of Water.
Nabii Elvis Mbonye.
The Holy Ghost is saying, set them apart, sanctify them, separate them. You understand this? He says your life should be a life that is sanctified, that is set apart, that is separated from the rest of the experiences out there in the world.
Huyu ni Nabii Elvis Mbonye. Nabii aliyethibitishwa na nguvu za Mungu, anayefanya ishara na utimilifu wa unabii wa ulimwengu ambao umebadilisha nchi na nchi kwa nguvu za unabii. Kila Jumapili, Nabii Elvis Mbonye saa 10:30 jioni kupitia TV ya East Africa, kupitia tovuti ambayo ni prophetelvis.com/live.